Hi, everybody. I had a patient follow-up visit the other day that inspired me to talk a little bit about some of the take-home messages that came from that patient interaction. And the main take-home message is that it's really important to make sure that we're working with a treatment protocol that's tailored to the patient as an individual. This is a patient who had a past history with dealing with a lot of gastrointestinal issues, SIBO, yeast overgrowth in the gut, also had mold exposure, had issues with chronic infections, so viruses and microbes like Borrelia and Bartonella and other co-infections. So kind of a whole gamut of things going on. Not a whole lot of heavy metal related issues, methylation issues, didn't have a high histamine picture like a mast cell activation syndrome or histamine intolerance, but I had a lot of things going on. And so over the course of time, working with a protocol, various protocols, we got the patient to the point where they were doing quite well. And however, there were still some lingering cyclical symptoms that were coming up. And so every so often, every few weeks, there'd be this sort of flush of symptoms that would come up. And and so of course the patient said, I'm feeling a lot better compared to baseline, but I still have these symptoms that are coming up in a cyclical way, and I would like to get rid of those too. And I said, I also would like you to get rid of those. So let's keep working on this. And so it turned out that it was still related to an underlying mold related issue. And so, or at least that clinically, that seemed to be the most likely explanation for what was going on. And so we started on a protocol and, phased in a binder, no problem, phased in phase 1, phase 2, phase 2.5 detoxification support, no problem, tolerated that beautifully, brought in a nasal spray to start killing off mold that would there was clinical suspicion that there was colonization of the sinuses. We had a positive mycotoxin test, like a urine mycotoxin test, which came back with notably elevated mycotoxin. So that gave us the data that supported the idea that yes, there is likely a mold illness picture going on here or still ongoing. And so started a nasal spray to help kill off mold that may have potentially colonized the sinuses, and major flare up. And so we really had to, stop. We had to stop that, and actually had to stop everything because there's quite a notable flare, unfortunately. But then we're able to build everything back up again. Started building up nasal spray again, a lot slower this time, and it still tipped the apple cart. Still had a flare up, not as bad as the first time, but still had a notable flare. And so what we're working with now is a much more measured escalation of the dosage of that nasal spray, of the concentration of the nasal spray, essential oil-based nasal spray. So the take-home message is that we really need to use an individualized approach, because if we were using more formulaic types of protocols saying, well, you have these test results, they're indicating that there's a mold issue, so you're going to go on a binder, detox support, nasal spray, and just muscle through it until you're feeling better. That just wouldn't have worked in this patient's case. In this particular case, I think that person would have just become bedridden until we took that nasal spray out of the equation in that particular case. And sometimes there's issues with the binder. Sometimes there's an issue with the detox support. Sometimes there's an issue with everything. So again, it's just really important to make sure that we're using the right protocol for the right patient at the right point in time to get the best results, and to make sure that a patient's tolerating that protocol well.